Did you know that it can be dangerous for certain diabetics to do their own foot or nail care? Why are primary care doctors so adamant that you as a diabetic go to a podiatrist for your foot or nail care? Why is diabetic foot care so important to have done by a podiatrist? Does Medicare even cover diabetic foot care? Well, I'm going to cover all those questions and more in today's video, so stay with me. Hey, I'm Dr. Gaffney from Dr. Gaffney Best Foot, here saving you time and money in your foot care decisions. So why can diabetic foot care be dangerous for you to do, and why is diabetic foot care so important? Well, it involves the danger from the high blood sugar to your little blood vessels and nerves over time, and how it damages the little blood vessels and nerves if you've been diabetic for a long time with high blood sugar. So if you have damage to your nerves, we call that neuropathy. And sometimes with the neuropathy, you have a numbness of your foot, so you can't feel. And so when you do your own foot care, sometimes you can't feel when you're hurting yourself, and you actually can create a wound and not know it until it's too late. And because you have lack of blood flow down there, it doesn't heal well. It can turn into what we call a diabetic foot ulcer. And that's when your body doesn't heal the wound because of the high sugars. And the longer the wound has been there, or the ulcer has been there, the harder it is to heal. It gets more stagnant to healing and more prone to infection. In fact, high blood sugar in diabetics makes it very hard for you to resolve an infection, makes it easier for you to get an infection too. So what happens is the wound gets infected, and it can lead to hospitalization and, worst case scenario, amputation. So that's why diabetic foot care is so important, and why it can be dangerous for you to do your own diabetic foot care if you're at risk. And I'll explain to you what that is later on. And Medicare recognizes the importance of this, so they actually pay for it in some cases, and I'm going to explain to you in the proper circumstances that they do pay for it. There have been studies that show diabetics getting routine foot care and proper care with their podiatrist have a less amputation risk. So it's been shown to be very important for diabetics to have a podiatrist. So we know it's important for diabetics to receive diabetic foot care or nail care, callus or corn removal by a podiatrist. So why a podiatrist? Why can't you just go to a nail salon and go to a pedicurist? Well, for one thing, pedicurists do not have any medical training, and podiatrists are foot experts and doctors. Pedicurists are more focused on the aesthetic and how good they can make your feet look. Podiatrists are focused on preventing diabetic foot complications and limb salvage. And I don't know how many times I've seen a patient come in for diabetic foot care, and they have other small problems that we nip in the bud before they turn catastrophic. And all podiatrists are good at doing this. They're good at recognizing small problems and stopping it before it turns catastrophic. And that's done time and time again at the diabetic foot care appointments. So that's one big reason why you should be going to a podiatrist for your foot and nail care and not the nail salon. The second reason is the fact that pedicurists are for looks and for the aesthetic of your foot. So they're going to be doing a lot of digging around in your toenail. They dig out all the debris and then push back the cuticle, which is a no-no. So they can create some micro trauma and allow bacteria to get in there. When you push back the cuticle, that's a natural barrier to fungus and bacteria into your body, into the nail unit there. So when you push that back, it opens the door for that to come in. So Medicare does cover at-risk foot care for some diabetics, not all diabetics. So how you determine if Medicare or even your commercial insurance will pay for diabetic foot care is you make an appointment with your podiatrist and they do an exam. And if they find certain findings on your exam that qualify you, then Medicare will pay for the diabetic foot care. So those exam findings are an absent pedal pulse or foot pulse, and changes in the skin and nail consistent with decreased blood flow for the foot to the foot, as well as changes consistent with nerve damage or neuropathy. So if you have those findings on your exam, you're considered at risk, and Medicare will pay for your diabetic foot care every 63 days, not a day before, because if you come every 62 days, Medicare doesn't pay for it. If you don't qualify, that is fantastic. That means that your feet are in good health. You just need to be seeing your podiatrist once a year for your diabetic foot check. So it's so important to have a podiatrist because things can happen to the diabetic foot out of the blue, and you need a podiatrist to be in your corner to help you through all that. Now, if you have neuropathy, I did do a comprehensive video on diabetic neuropathy and all the current treatments, so check out my video here. If you want to find out if you're at risk to developing a diabetic foot ulcer, please check out my video here. And also I have in the description a link to tips prevent diabetic foot complications, so you can click on that and get the printout of all those tips. And thanks for watching. Please see the full disclaimer in the description. This is not a doctor-patient relationship. This does not constitute medical advice, but is for informational purposes only.